Assalamu alaikum wa rahmatullahi wa barakatuh. Dear student, today inshallah we're going to talk about the bone. First, you should know that the bone is a type of connective tissue in which the matrix is solid, formed of cells, fibers, and matrix. As we said, it is a type of a connective tissue in which the matrix is solid. The bone is characterized by being covered externally by something called periosteum and lined internally by the endosteum. The cartilage is highly vascular and it arises from undifferentiated mesenchymal cells. These cells are separated by matrix, and this matrix is hard due to deposition of calcium and phosphate. The bone is formed of cells, fibers, and matrix. The cells are known as osteogenic, which is the stem cell. Osteoclast is the one that build the bone. Osteocyte, the cell that maintain the bone, and osteoclast, the cell that will eat the bone. The fibers, we have collagen type 1, which is the strongest type of collagen fiber in your body. The bone matrix is hard as due to deposition of calcium salts. We have four types of cells: the osteogenic, which is the progenitor cell; the osteoclast is the bone forming; the osteocyte is a mature bone cell; and the osteoclast is a bone eating cell. This is a diagram. This is the osteoclast present on the surface, produce bone. When it becomes surrounded with calcified matrix, the osteoclast changes into osteocyte. And this is the osteoclast, the bone-eating cell that become active during development of the bone and during healing of fracture. The osteogenic cell, where could I find it? It arises from the UMC present in the inner cellular layer of the periosteum and in the endosteum. They are flat cells with flat nuclei, and the cytoplasm is pale basophilic as it divides to give the osteoclast. Contains organelles, it has ribosomes and centriole as it is mitotically active cell, divide and give rise to the osteoclast. As you can see here, the osteoclast is protein producing cell, deep basophilic cytoplasm with negative Golgi image, and the nucleus is pale with prominent nucleoli. The osteoclast arises from the osteogenic cell, so they are present near the periosteum and endosteum. They are active cells, bone forming. They are arranged in the form of as if they are epithelial cells near each other. The cell is branched with few processes, a rounded eccentric nucleus at one side, basophilic cytoplasm with negative Golgi image. By EM, feature of protein producing cell, RER, Golgi apparatus, mitochondria, and we have secretory vesicles. These secretory vesicles secrete what's so-called alkaline phosphatase, which is needed to precipitate the calcium. Here is a diagrammatic picture. You can see here the osteoclast present as if they are epithelial cell. They produce the bone matrix, and when it is imprisoned in a calcified matrix, it changes into osteocyte. And this is the osteoclast, which is the bone-eating cell. What is the function of the osteoclast? Synthesize the organic component, which is collagen fibers plus the matrix, and then it secretes alkaline phosphatase that take calcium from the blood and precipitate it in the matrix. When become imprisoned in calcified matrix, it changes itself to be osteocyte. Here is the osteoclast that change into osteocyte. It is imprisoned between the bone lamellae. It has processes. These processes communicate together with the neighboring cell in order to pass nutrition from one cell to another. The origin of the osteocyte is the osteoclast. They are present inside a lacuna, bony lacuna, communicated together through the canaliculi. By LM, they are smaller and less active than the osteoclast. The cytoplasm is dark, the nucleus is dark, and the base of the cytoplasm is less basophilic and less organelles. This is an osteocyte present inside a lacuna. This is the lacuna, this is the processes, and these are the canaliculi. It has less smooth endoplasmic reticulum Golgi apparatus. It has processes present in the canaliculi. The function of the osteocyte is just to maintain the matrix. The bone-eating cell called the osteoclast. It is a giant cell. In order to eat the bone, I should have two important features. I should have lysosome in order to digest the organic component, and I want to remove the calcium, so I want something acidic in order to remove the calcium from the bone to the blood. The osteoclast arises from fusion of monocytes together, forming giant cell. The surface that near the area that I'm going to digest contain microvilli to increase the surface area. It arises from fusion of the blood monocytes. The bony surface they are present on the bony surface that will face the resorption. Large cell with foamy acidophilic cytoplasm contains many nuclei, which is fusion of many monocytes. The cell, the part that face the part I'm going to resorb called the brush border, which is rich in microvilli, to increase the surface area. It contains Golgi apparatus, mitochondria, and lysosomes. How the osteoclast will work. It contains carbon dioxide that reacts with water, forming carbonic acid that dissociates rapidly into hydrogen and bicarb. This hydrogen forms acidic media that let the calcium move from the bone to the blood. The lysosome secreted from the osteoclast dissolve the organic components of the bone. The function is something called bone resorption that occurs during growth and repairing of fracture. Lysosomal enzyme cause lysis of the matrix, and hydrogen ion cause acidic media that take calcium from the bone to the blood. The bone matrix, which is about organic components about 35%, formed of collagen fiber type 1, which is the strongest type of fiber. The gram substance formed of protein and carbohydrates. First, the organic component is secreted, then alkaline phosphatase precipitates the calcium in the bone lamellae. The inorganic component appears due to deposition of the calcium ion. This deposition occurs in a parallel lamellae that produced by the osteoclast. What is the periosteum? To the outer cover of the bone. It's formed of outer fibrous layer and inner osteogenic layer, present all over the bony surface except the area of the joint. The outer fibrous rich in blood vessels for collagen type 1 and fibroblast. The inner contains osteogenic cells. The periosteum function: nutrition, give muscle attachment and appositional growth. As the inner osteogenic give rise to osteoclast, and the osteoclast form new bones, so it increases the thickness of the bone, increase the diameter of the bone. The endosteum is the inner lining of the bony cavities, formed of single layer of osteogenic and loose connective tissue cells. It supplies the osteogenic for growth and repair of bone. Histological: the bone divided into two components, which are compact bone and spongy bone. Here is a diagrammatic picture. You can see here that the compact bone present in the shaft of a long bone, while the spongy bone occurs present in the center of the epiphysis. So the types of bones, we have compact bone and spongy bone. Here is an TS section of compact bone. This is the bone and this is the bone marrow, and this is the skeletal muscle attached to the bone from outside. As you can see here, the compact bone, there is no space. It is all solid, compact in order to bear your body weight. The functional unit and the structural unit of the compact bone is something called Haversian system. The compact bone present in the shaft of a long bone and as well as in the outer inner table of the flat bone and the outer aspect of the spongy bone in the irregular and in the flat bones, as the compact bone present in the outer shell gives strength to the spongy bone. As I said before, the osteoblast form bone in layers, and after the osteoblast become imprisoned in the bony matrix, it changes its name from osteoblast to osteocyte. Here is organization of a compact bone in the shaft of a long bone. The outer cover is the periosteum and the inner aspect is the endosteum, and these are cylindrical structure which are the Haversian system. Dear student, look here, this is the Haversian systems formed by central canal known as Haversian canal, concentric bone lamellae between which is the osteocyte present inside a lacuna. Putting cylindrical structure near each other, spaces will appear. Spaces will appear between the periosteum and the Haversian, and here the osteoblast will arrange itself parallel to the periosteum, and the osteoblast form new bone, change its name to osteocyte, and the bone lamellae are parallel to the periosteum, and this is called outer circumferential lamellae. Between the endosteum and the Haversian system, the osteoblast arranges itself parallel to the endosteum, producing bone lamellae containing osteocytes in between, forming inner circumferential lamellae. Between the Haversian system, there is interstitial bone lamellae. Here is the Haversian canal. These are the Volkmann canal, which is a transverse canal that joins the Haversian system to the periosteum, Haversian to Haversian and Haversian to endosteum. So the organization, the periosteum, outer circumferential lamellae, Haversian system or osteome, interstitial lamellae, inner circumferential lamellae, then the endosteum. What is the Haversian system? It's formed of Haversian canal that run parallel to the long axis of the bone, containing blood vessel, surrounded with concentric bone lamellae, between which is the osteocyte present inside lacuna. What is Volkmann canal? They are communicating transverse canal that communicate Haversian system together, Haversian canal together, and with the periosteum and the endosteum. How to prepare a bone section? It's difficult to prepare the bone matrix. Why? Because the matrix is solid. So first you should remove the calcium. In order to remove the calcium, I should put it in acidic media. In order to get rid of this calcium and the bone change into soft tissue. What you can see here is the periosteum, outer cover, Haversian system, and endosteum. The Haversian system is formed of Haversian canal, concentric bone lamellae, and osteocyte present in the lacuna between the bone lamellae. I can use another method, which is ground compact bone. I'm going to sew the bone. I'm going to take a section. I'm going to grind it using the saw. It will be a very thin slice, and I put it on a slide without staining. What you can see here, the black color, which is the air that present in these spaces. These spaces are the Haversian canal, lacuna, and canaliculi, as well as Volkmann canal. All living cells are dead and not decayed, and you cannot see it by the microscope. You only see the concentric bone lamellae. as papaya paper. The air inside the Virgin Canal, Lacuna Caliculi, as well as the Volkmann's Canal. The bone allowed to dry and sewing it with a very thin slice to be transparent and then fixed on a slide. Without staining, what I can see non-living tissue, I can see lacuna, Virgin Canal, Volkmann Canal appears black and fine hair of the canaliculi. No details, no cells can be seen. The second type of a bone we're going to talk about is the spongy bone. The spongy bone is present in the center of irregular bone, flat bone, short bones. They do not appear as a bone lamellae, they appear as bone trabeculae, branching and anastomosing. So this will lead to presence of cavities. These cavities form with bone marrow. Where could I find the spongy bone? In the center of the epiphysis, flat bone and irregular bone. Why I said in the center? Because the periphery has is formed of the compact bone. It is formed of branching and anastomosing irregular bone trabeculae, osteocyte present inside the lacuna. Between the trabeculae there is multiple bone marrow cavities. As you can see here, branching and anastomosing bone trabeculae will lead to the presence of the bone marrow cavities. This is light microscopic picture of bone trabeculae. In between them there is the bone marrow cavities, and here is a part of a compact bone. Now we're going to study the bone ossification, which is bone formation. I'm going to form bone from what? I'm having two types of bone, the compact and the spongy. So logic, I'm going to have two types of ossification. Ossification to start in a membrane, and this is called intramembranous ossification, that will lead to production of spongy bone. While intracartilaginous or endochondral ossification, replacement of a cartilage by bone, this will end either with spongy or compact bone. The intramembranous ossification occurs in the flat bones at the skull, clavicle, rib, irregular bones. First, the first step in ossification is the increased blood supply. The membrane is formed of undifferentiated mesenchymal membrane. Increase in the blood supply will change the UMC into osteogenic cells. The osteogenic cells will form a bone to form osteoblast. The osteoblast secrete the matrix and change into osteocyte. This occurs in irregular manner, forming trabeculae, which branch in this irregularity. Bone marrow cavities will appear between the bone trabeculae, forming the spongy bone. Again, here is the membranous tissue, which is the UMC, formed of undifferentiated mesenchymal cell. Increase in the blood supply will change these undifferentiated mesenchymal cell to osteogenic cell. The osteogenic cell change into osteoblast, and the osteoblast form new bone, and the osteoblast will be imprisoned in the bone matrix and change its name into osteocyte. Again, this is the UMC, this is the osteoblast, and this is the osteocytes after imprisoned in bony matrix. This occurs in radial manner, so the end result is bone trabeculae separated by cavities. These cavities will be occupied by the bone marrow, so here I form the spongy bone. Intracartilaginous ossification, I'm going to replace the cartilage model, which is the hyaline cartilage, by the bone. First, and this occurs in the shaft of long bones. Take place by replacement of the cartilage model, which is the hyaline cartilage, to the future bone. First, I'm having primary center of ossification, which is increase the blood supply to the shaft of a long bone, or shaft of the future bone. This occurs in the diaphysis. Increasing blood supply to the perichondrium, in the center of the perichondrium. The inner chondrogenic change into osteogenic, so the perichondrium change into periosteum. The inner osteogenic change into osteoclast, and the osteoclast form bone. So I'm going to form what's called a bone collar. The inner osteogenic form osteoblast, and the osteoblast form bone, and this is called appositional growth because I'm putting bone from outside. This will serve as a support. How? Putting bone at the surrounding the cartilage. The cartilage, you know, it is avascular and need nutrition. Here I stop the nutrition entering to the hyaline cartilage. And the chondrocyte contain alkaline phosphatase and precipitate calcium in the matrix, and this will lead to death of the chondrocytes. So the chondrocyte will die due to two factors: formation of the periosteal bone collar and secretion of the chondrocytes to alkaline phosphatase enzyme. Then, after death of the chondrocyte, the monocytes fuse together, forming the osteoclast, and the osteoclast will remove the calcium between the dead chondrocytes, and I'm going to bring more osteoprogenitor cells that change into osteoclast and will form bone matrix in an irregular manner, forming the spongy bone between the bone marrow cavities. Here, I don't want to form spongy bone, I want to form compact bone. So there is a work antagonizing together the osteoclast and the osteoblast. The osteoclast start to resorb the irregular trabeculae, forming single bone marrow cavity, and the osteoblast start to form new bone, and in a regular manner, forming the Haversian system and changing the spongy bone into compact bone. All what we discussed was in the shaft. What happens in the epiphysis of the long bone? On the time of birth, a secondary center of ossification 2, secondary center of ossification 1 in the upper one, the lower of the epiphysis, and spongy bone will be present in this area, in which the cartilage will be replaced by spongy bone. Between the primary and the secondary center of ossification, an area known as epiphyseal plate, which we talk about in the cartilage. This is hyaline cartilage. It remains cartilage for the age of 21 years. This epiphyseal plate divides to increase the length of the future bone. As it divides, increasing the length of the cartilage that will be replaced by the bone during ossification, increasing the length of the bone. This is the resting stage of the cartilage, and this is the proliferation to increase the size. Here is hypertrophy and calcification and spongy bone formation. The appositional growth of the bone, increasing the diameter of the bone, occurs due to the inner osteogenic cell that will change into osteoclast and will add bone from the outside. This is a diagram showing the model in the form of hyaline cartilage. Primary center of ossification by the increased vascularity. The blood vessel here changes the perichondrium into periosteum. How? The inner chondrogenic cell changes into osteogenic by increased blood supply. The osteogenic will change into osteoblast and lay bone, and this is the bone collar. Okay, here the chondrocyte in the center will secrete alkaline phosphatase to precipitate calcium in the matrix, so the cartilage here will die. Then the blood here carrying monocyte that fuse together to form osteoclast will open the cavities together, and I'm going to have the osteogen to form new bone. First, the bone that formed in the form of a spongy bone, then the osteoclast by a process of remodeling action of the osteoblast with the osteoclast The osteoclast will digest the bone trabecally, and the osteoclast will form the compact bone, which is organized in the form of a Haversian system. Secondary center of ossification occurs before birth at the center of the epiphysis, but just I'm going to have only spongy bone. As you can see here, this bone, this is the shaft formed of compact bone with bone marrow, single bone marrow cavity. In the epiphysis, we have spongy bone. Cartilage remain in the epiphyseal plate and in the articular surface. The epiphyseal plate here remain open till the age of 21 years. It divides to increase the length of the cartilage. Here the data show for the bone. Here is compact bone, TS section in the compact bone, and this is the skeletal muscle, and this is the bone marrow cavity. Here is the structural and functional unit known as Haversian system or the osteon, formed of Haversian canal, concentric bone lamellae, in between them lacuna containing osteocyte. This is a diagrammatic picture of decalcified compact bone. It is covered with periosteum and lined with endosteum, and these are the Haversian system, containing Haversian canal, concentric bone lamellae. Between the bone lamellae are osteocyte inside lacuna. Haversian canal connected to the periosteum and to each other, as well as the endosteum by the Volkmann's canal. This is ground compact bone. You can see the black, it is the air present in the cavities, which are the Haversian canal, Volkmann's canal, lacuna, and canaliculi. Again, this is ground compact bone. This is the Haversian canal. This is lacuna, does not contain anything, the osteocyte die, and these are the canaliculi. Again, this is ground compact bone. This is spongy bone, irregular bone trabecally, and these are the osteocytes present inside the lacuna. Between the trabecally there is bone marrow cavities, and there is in the outer shell of compact bone. This is a growing end of a long bone. Here is the hyaline cartilage. Here is the proliferative phase and maturation, then the calcification and spongy bone formation.